wanted to spend a moment talking about a program I'm very passionate about called GenerationRX. Hopefully you're already somewhat familiar with GenerationRX. Maybe there was a student chapter at your university. It started out as a partnership between Ohio State University and Cardinal Health. The idea is to focus on messages that prevent prescription drug misuse. They also focus to teach how to safely use medications and turn down invitations to misuse, while also teaching alternative mechanisms to cope with everyday life. The program is really focused for teenagers, but we also have programs and information and guides for younger, older, workplace. So it really does cover every age generation that we can get. What prescription drug misuse is defined as is taking more medication than prescribed, taking medication for a different reason than prescribed, or sharing or using somebody's medication in any way. What happens as a whole in society is we find that most teens are not misusing medications. But we do have over 326 million people over 12 years old in our population. And in any given previous 30 days, 6 million of them have misused a prescription medication. So even though we find that most teens are not misusing, we do find that we have a large number of teenagers that have or might fall victim to that attempt and trying and maybe going further down the rabbit hole, so to speak. We want to try to catch them while they're younger. Why do we have this drug epidemic? So in the US, we've pretty much normalized taking medications. Even though we make up less than 5% of world population, we consume more than 80% of painkillers. That's very disproportionate. We really just want a quick fix, don't we? We want to take something that we think is going to make us better, and that's all we really want to do with it. We don't want to make much effort. It doesn't apply just for pain medications, of course, so you can see how easy it could be for somebody to take a medication and think that it's going to fix everything. We've also kind of done a bad job at teaching the safety requirements for these medications. These medications require a healthcare professional for a patient's safety. So many people don't believe that they're actually addicting. Many people believe that they're safer than taking a street drug. And we know as pharmacists that medications, even though they are prescribed, can be just as, if not more dangerous sometimes than street medications. So that's what we look at as a whole. We also have to look at the impact. So for our top death, we have unintentional injury. In that category, we generally look at motor vehicle accidents as our top reason for unintentional injury deaths from 5 years old to 24. After that age group, so from 24, 25 up to 64, unintentional injury deaths are led by poisoning, which for the majority is a drug overdose. So that is the leading cause of unintentional injury death until 65, when all of a sudden it goes to falls. So that's a huge consequence, and it's a large number of our population lost to drug overdose. So it's important that we teach this message early, that we don't want to take other people's medications. We take only what we're supposed to. So what I've done for this program is I've partnered with our county's middle schools, and I'm starting with their National Junior Honor Society programs, and they also have outreach clubs, and eventually I'll be doing boys and girls as well. But I'm working with them to do a session or two teaching them about what's going on in our communities, teaching them some tools on how to avoid getting caught up in that and know the right thing to do and why. And then I'm going to have them branch out and teach their peers. So those students will actually be going in small groups of 4 to 6 into classrooms and doing some role play, doing some presentation to help get that message out to their peers. So they're getting some leadership skills, they're getting volunteer hours, but we're also reaching a large number of teenagers by doing this kind of peer-to-peer teaching. So I hope that you look at doing program, not necessarily the same thing that I've chosen to do, but some type of program to make an impact in your community. This is something that directly relates to those that I wave at in my neighborhood, that I see at the grocery store, my friends' children. This relates to the community as a whole. So it's something that I can do to help make an impact. And GenerationRX gives me every tool I need to provide that message. And I hope you find something that you can be compassionate about and give to your community.